discussion here. We'll have Mike Pieciak, Commissioner of the Department of Financial Regulation, joining us. But right now, we're really pleased and honored to have Dr. Levine, Commissioner of the Vermont Department of Health, with us. And it's kind of timely that it's on the day when the governor announces that he's lifting restrictions in the state of Vermont and whatnot. And I got a chance to hear that at 11 o'clock this morning, or during that hour, and Dr. Levine participating in that too. So it's just quite a coincidence that we're having you grace us today with your presence while I guess some people might consider the end of the pandemic as far as restrictions have arrived. For those of you, we had Dr. Levine with us one time early on in the pandemic when things were a bit different than they are now, and there were a lot more unknowns, although there's still some. But for those of you who haven't met him before, heard him directly before, I should give you a little bit of background. Dr. Levine is, although the titles have changed, he's the 14th commissioner by my count of the Vermont Department of Health, or whatever it was called originally, a position that he's held since he was first appointed by Governor Scott way back, and I'm sure it seems like a long time ago now, Dr. Levine, in March of 2017. Prior to his appointment in service in public life, he was a professor of medicine at the University of Vermont, an associate dean for graduate medical education, and an institutional officer at the College of Medicine and the UVM Medical Center, and vice chair of education in the Department of Medicine, and has participated in a whole lot of different projects, has a lot of honors and whatnot, way too lengthy to mention, but they all add up to our Commissioner of Health. And again, we're really honored to have you here. So thank you for joining us today. And I've got, by the way, a copy of your PowerPoint. You should be able to share if you want, but if you prefer to have me run it, I'll do that for you, whatever works for you.
I'll give it a try. We'll
Awesome.
see. Thank you all for attending, and Joe for inviting me. There are still plenty of unknowns, believe me. So there'll be no shortage. And though we did close a phase of the pandemic today, we still live in a world, and it's by no means closed. So it's not going to disappear from everybody's radar screen. Let me see if I can get my slides up here.
And there we go.
I have to always adjust them. Are you seeing just one slide?
We are.
All right, success. I'm going to keep the slides relatively brief so that we have time for questions and answers and discussion before Commissioner Pieciak comes along.
Great.
But I'm going to try in one presentation to rapidly transition us from past to present to future. And we'll see how this works. We're going to learn a little bit about how we've shaped policy through epidemiology, where we've come from, and where I think we're going to. So you may recall back in the beginning, we knew nothing about this mysterious virus that had never afflicted mankind before. We knew before it got here, it was coming. We've been following things very closely in China and then in Washington State, and knew it was only a matter of time. So we very early on activated our Health Operations Center and our State Emergency Operations Center, and really had a sense of urgency from the outset, which I think did help predict some of the successes we had. The other thing we learned is that it was spreading through communities, and once it arrived, there was no way to stop that process. We didn't really have a playbook. All we had was a pandemic flu playbook from the CDC from 2017, which we used, but obviously it wasn't sufficient for this novel virus. But it gave us a good starting point. But early on, I mentioned we saw there was community spread. We knew that traditional management of a respiratory virus through containment was not going to work. And just to review for you what containment is, it's all predicating on having a test for the virus, being able to find people with it through the tests, isolate them so they don't infect others, talk with them and interview them extensively, and that's called contact tracing, to understand where they may have got it from, but more importantly, who they may have been with while they were infectious and given it to, so that we can then quarantine all of those contacts. Such a simple process, but we couldn't do any of it in the very beginning. Because of that, we spent a lot of time on the concept that you may recall called flattening the curve. We actually pulled out this poster today because it had such meaning in the context of the whole pandemic. And the red has faded to orange because it's been sitting around for 15 months. But the bottom line was we wanted to flatten the curve because we knew that if we didn't do anything, we would be the red part of this graph. Cases would escalate through exponential growth of the virus very quickly. And that dotted line, the healthcare system's capacity would be exceeded very early on, and people would die. And that would not be the outcome we want. So flattening the curve meant converting it to the bluish curve, which means instituting a variety of mitigation measures, so-called non-pharmaceutical interventions, which you may all recall because we sort of sequentially started reducing gathering size, sending people home for work, closing bars and restaurants, and eventually stay home, stay safe. That's all you have in your tool quiver when you don't have containment. So we did it in a very phased and progressive way, introduced these mitigation strategies. Thank goodness we had a governor who actually believes in science, believes in data, prioritizes health and safety as the things he has to do if he does nothing else right as a governor. What explained how we got to such a low incidence rate of virus and low deaths and percent positivity? We always begin with the Vermonter themselves because we always rank high when it comes to prioritizing health and being the healthiest state in as many surveys as we can be. And we couldn't do that if people didn't buy into what we were talking about. They're very cooperative, compliant, collaborative. We have a tradition that we continued here of protecting the most vulnerable, which in the case of a virus means people who live in a congregate setting. When we finally got through stay home, stay safe, we didn't just do what most of the southern states did several times during the pandemic, which is just reopen. We basically reopened in a very cautious way and waited till the suppression of the virus was at a significant enough level that we felt comfortable. We understood contact science, which I'll get to in another slide. And we used public health science throughout, and people actually accepted that in Vermont because they felt that the governor and myself, the health department, through surveys we've learned this, were trusted messengers and trusted resources where they went to for health information. We learned some important lessons. This virus is different than all other viruses, well, not all other, but many others, because it can be spread when people have no symptoms at all, and they don't even know they're going to be able to spread it. And it can be almost half the cases that can be spread that way. We learned to validate so-called simplified guidance. Wash your hands, cough into your elbow, make sure that you stay home if you're sick. We learned that once we could do testing, containment actually does work. And we very effectively got through till the turn of the year, 2021, when the whole Northeast got overwhelmed by the virus and we could no longer be an island. But you do have to have testing and contact tracing capacity, and we had a government that was willing to ratchet it up and get as much of it as we needed to manage this pandemic. Many states kind of gave up on that when they got overwhelmed. We also learned how to target testing and learn what surveillance populations would help us understand how well we were doing against the virus, and to stockpile supplies, because we got burned very early on with PPE, with supplies, you name it, and we had to learn how to stockpile quickly. I mentioned protecting the vulnerable. We did that in our nursing homes by having very strict visitation restrictions. We had testing policies whenever a case would arise. The greatest threat to a nursing home is either the staff bringing it in or a new admission bringing it in. So we made sure that the staff were tested frequently and that the new admissions were tested and quarantined upon admission. We also did this in our correctional facilities. Importantly, for this audience especially, and I hope you'll agree with me, public health and economic health can coexist. Not always comfortably, and it's not always wonderful news for everybody, but the fact is you can still have a state like Vermont that actually achieved about 80-something% of its prior economic status during the pandemic, which is actually high in this country. And there are other states that did just as well as us, but had extraordinarily high numbers of cases, hospitalizations, and deaths. And you can balance reopening and risk. We learned that it doesn't matter if you're urban or rural, the virus doesn't care. And we learned to have a diversified portfolio for testing so we wouldn't get burned. And I won't have time during the presentation, but if you have questions, I can answer them. We learned a lot about health equity, making sure that disadvantaged populations, whether they are defined by race, gender identity, economic class, you name it, can have equity during a pandemic, if you put your mind to it. So where did we come from over the last year or so? Well, we did learn about the containment, as I said. We learned contact science, meaning close contact, obviously, are higher risk of spreading the virus, whether that's with your dentist, doctor, or hairdresser. Contact density, meaning crowding. Gathering sizes had to be markedly reduced, and people avoid being in crowded indoor places. And then duration, because we know that if you're going to be named as a close contact and be at risk of getting the virus, it means you're either in a place with too many people or for too long a time with a contact. We learned a lot about ventilation, which I won't go into here today, and simplified guidance, as I mentioned. So where are we now? We're at a point where we had to convince the population in the midst of lots of disinformation to trust the vaccine and believe the truths. Number one, not only did the vaccine work in the clinical trials, it works in the real world, and we've had abundant data to support that. Second, it works against variant strains, all of them. Third, if you are vaccinated, you are much less likely to spread the virus to another person. You may actually find some virus if we swab your nose, but it probably isn't viable virus that somebody else could get sick from. Vaccination does equal protection. And though there is always going to be unvaccinated people amongst us, some of them are going to have some natural immunity and won't be as susceptible as we think, although the vaccine-mediated immunity is still regarded as superior and additive. And of course, we need to always protect the most vulnerable, no matter what the pathogen. Here are the variables for the future. We at 80% now of those age 12 and above might be as close to this herd immunity or community immunity concept as you can get in this country or in the world for that matter. And we should capitalize on that, obviously. If that number turns out to be much higher, which I think is unlikely, then we won't achieve herd immunity. But the fact is, we're not stopping at 80% either. We're already at 80.2%, and we're going to keep going. The degree of viral suppression clearly matters. We're having case counts in the single digits again, so we know the virus is being suppressed. It's not transmitting from person to person because too many people are dead ends for the virus. They've been vaccinated. We will continue to follow all the numbers we've always followed all the time. Try to gain some knowledge of what's the prevalence of the virus by the case counts and the percent positivity. And if we need to reinstitute mitigation measures, obviously that would happen, but it seems very unlikely at this time. Here are the unknowns that I promised you in the beginning. First of all, will this become a seasonal respiratory virus? It's a little unclear. Last year, we had the South and the West get overrun with the virus in July. Now, some people say, well, when you're in Arizona, you don't go outside in July. You're in an air-conditioned building with a lot of other people, but I'm not so sure I buy that as the whole explanation. We're finding this is true now around the world, too, where there are places with hot climates that still have plenty of virus during that time of year. But if it does become a seasonal respiratory virus, it'll just be because people are more in touch with each other in a crowded indoor setting during the fall and winter months. But if many of them are protected, again, we should be safe. We'll have a lot of work to do to differentiate flu and other respiratory viruses from COVID during those months. Boosters and reformulations. So no one doubts there'll be a need for boosters. The question is, will that be at the 1 year mark? Will that be longer than 1 year? And we're still learning by following people from the original clinical trials to make that estimation. But they're not tomorrow. And then the reformulations are, well, what if there's a variant that's even worse than the B117, worse than the Delta, and the vaccine can't handle it? Well, the good news about the messenger RNA vaccines is you can insert a piece of DNA into the vaccine and your body will then make antibodies against it and you can take care of a booster. That implies that novel variant strains could become a problem. We don't know that yet. They're becoming more of a problem right now in the UK, which had been doing very, very well with its vaccine strategy. We're going to have to see how things play out. A lot of people in the UK have not received their second dose compared to Vermont. We're going to be impacted by what happens in the rest of our country. Right now, the Northeast is a real sequestered, protected corridor. All the rates in the vaccine are the highest in the country in the Northeast. Vermont is the highest of the Northeast, but still, we're relatively protected in our region. If the rest of the country gets overrun by something because states like Mississippi have half the vaccination rate that Vermont does, who knows what impact that might have on us and on the development of more of these mutations and variant strains. And then going beyond the borders of the US, we have a world where in some places less than 2% of the population has even seen a vaccine. So the virus has the opportunity to continue to get transmitted, continue to undergo mutation, continue to develop new strains. And it will continue to do that. That's what viruses do. So what will that global impact then be on the US and on the Northeast? And then just sort of to have a few healthcare things in here, telehealth has been really a valuable tool. Can we continue to make that a valuable tool and make that a part of our healthcare system long-term and have it continue to get reimbursed in a handsome way so that there'll be some incentive to do it? And then finally, will we have yet other epidemics of other diseases because people neglected their healthcare during the pandemic? Things like heart disease, diabetes, etc., that could have been picked up earlier. It may have been symptomatic earlier, but people sort of hung out there with them because they were afraid to go to the healthcare system, thinking it was not a safe place. Turns out it was one of the safest places to be. But the reality is there may have been a lot of unattended to symptoms with disease presenting at a later stage with less of a good prognosis. There could be a lot less preventive medicine that will allow things to develop that might not have developed. So I leave you with that gestalt of 1,000 thoughts to sort of set the table for, another 10 minutes or so of questions or answers or whatever. I'll let Joe pick up here, and I'll stop sharing the slides.
Thank you so much, Dr. Levine. That was a great update that you provided. We appreciate it. Hey, any questions or comments from anybody while we have the opportunity here?
I just wanted to say thank you, Dr. Levine. You have been a voice of reason and calm during the last 15 plus months, and I just appreciate everything that you did for the state and Vermonters.
Thank you. I'm happy to take a tough question, though. I enjoy questions that don't come from the press so much more than other questions.
So I'll jump in. I'll follow a thank you with a question. But one of the things I wanted to add to that thank you is that as a manager at a credit union or business, it was really I can't tell you how much value we received by you being credible with Vermonters and our ability to follow the guidelines you put out for us to follow. It was the level of safety when we were dealing with so many other things in our business, it was appreciated. So the question that follows is obviously we're bringing our staff back to our offices beginning of July for the people that aren't in branches. And one of the challenges now becomes the vaccinated versus unvaccinated. The good news for us is 92% of our people are vaccinated. So I don't have a big population that isn't. We've done a survey. We just got the results of the survey. So we know we're very well covered. But your sense of how long we're going to end up having, different rules. I know there are rules, but some national guidance does show different rules for vaccinated versus unvaccinated.
Yeah, and the current rules are if you're unvaccinated, you should wear a mask indoors, not outdoors, but indoors. And then if there are any of your employees who are especially vulnerable, even if they were vaccinated, they're obviously going to want to wear a mask too if they have underlying immune system issues, et cetera. The thing you don't hear on the national recommendations and that will evolve over time is trying to look at where you actually are. Are you in a place where there's so little virus around that doesn't matter if an unvaccinated person is indoors or outdoors, they're probably not going to get into trouble because there's just not a lot of virus. And we're also seeing some of the studies that are in even nursing homes where 70% were vaccinated, 30% weren't. And the people who were unvaccinated actually benefited from some herd immunity because all the vaccinated people kind of took care of the virus and there wasn't a lot of people to transmit it. So I suspect we'll see perhaps at your businesses, perhaps in our schools, if the summer evolves and we just don't see much in the way of cases and we have a very high vaccination rate, we might say, we recommend if you're unvaccinated that you might want to wear a mask, but the reality is we're in a good place right now and the transmissibility potential for the virus is so low that if you choose not to, it's probably okay. We'd still rather you get vaccinated, but it's probably okay if you don't. And then we will just watch that over time. And obviously if that changes, we change our recommendation. Because there are people like kids under 12 who have no choice. They can't be vaccinated until at least the fall and who knows when. But if there's a chance for them to not have to wear a mask because we're just not seeing the virus in Vermont, well, maybe that would be something we could do based on our good track record.
Thank you.
I think did I read the other day that the rate of vaccination among 18 to 29 or so year olds, Dr. Levine, was like, 3/4 of that age bracket or so not vaccinated as of a couple days ago. And John's question, brings to mind that that age group is very prominent, I would think, in frontline contact positions in, the checkout at the grocery store and, maybe the teller window in a financial institution and so on and so forth. And I don't know where I'm going with this. It's just an observation, I guess, that those people, that age group, could have a lot of face-to-face contact and whatnot. And it makes me wonder whether the low amount of vaccination is, just an age bracket choice thing, a trend, or whether it's because their access is the most recent. Any thoughts on any of that?
Yeah, a lot of thoughts. So I don't think it's as bad as your numbers.
Good.
Between 18 and 21 is our worst age bracket, and that was a little below 50%. But I think the rest of that decade is in the higher 50s,
Great.
and hopefully increasing. The goal is actually that we bring the vaccine to them and make it something they could stumble over and then, oh, okay, I'll take it, I'm here. Because they're not resistant to vaccine. They're not, sort of so dogmatically against it. It's just that their life needs something more convenient. They may not have thought about it as much. It's not a priority, what have you. So we have actually great hope for that group. And I don't think it's as bad as you currently describe. I think the ones that are more in the public-facing positions, maybe the ones who actually are getting vaccinated, but there's still plenty that don't have those kind of public-facing positions that doesn't make them think about their risk all the time, like they would if they were. So don't give up hope. The numbers keep increasing for us on a weekly basis. The walk-ins are really handling some of that demand because these are not going to be people who are going to set up an appointment and all of that and go on a website to register. So, if they happen to be at North Beach or they happen to be at a state park and they're with a bunch of friends who have been vaccinated and they haven't, and their friends say, hey, here's your chance. They've got a tent right there. It will happen, we hope.
Hey, folks, we have to wind things down in our time with Dr. Levine, but one last call for, one last quick comment, question from anybody? Any non-press question from anybody? Canadian border, we're so close to it. What do you see happening there?
It's going to happen. I just don't know the timeline because that's up to the two chief executives, the prime minister and the president.
Canada was doing really well at one point earlier on.
Yes. And then they really didn't do so well, and now they're really doing well again, especially as Commissioner Pieciak has shown us recently, Quebec. But of course, Quebec is still part of a bigger country, so it's going to be a border thing, not just one border with one state. But their strategy for vaccination is actually working extraordinarily well. It had a very slow start, and at a time when they needed it to really be accelerated, but now it has. So I would be optimistic. If I were a betting person, I would say before September, but I wouldn't want to guarantee that. But probably not this month, but before September.
Well, it has been wonderful having you with us. We greatly appreciate your time, and we know that we've stretched it out by a couple minutes here. We're extremely appreciative for, again, as has been expressed, all the leadership that you've provided and the work that you've done on behalf of all Vermonters. It's been very helpful to everyone working in financial institutions, and we all appreciate it on a business level and a personal level. So thank you.
Thank you all, and I'm sure Commissioner Pieciak will keep the ball rolling here very well.
We'll soon find out. Thank you, Dr.
Bye-bye.
Levine. And Mike Pieciak, Commissioner Pieciak, I should say, I saw you join us. I know you're on the list someplace.
Yeah,
here.
hi, Joe.
How are you?
Good. How are we doing?
Awesome. And for, I think everybody on the line probably knows Mike, but just to make sure that I'm fair with both of our speakers, I'll do a little bit of background on Mike too, although most of you probably are well aware that Mike is the Commissioner of the Vermont Department of Financial Regulation. So that means that he oversees the regulation of everything to do with insurance, captives, banking, and securities in the state of Vermont. He was originally appointed to the position that he currently holds by Governor Shumlin way back in 2016, which probably, having gone through the past 15 months of pandemic, seems like an eternity ago. But he's continued in that position ever since, probably never expecting that he'd be doing the kind of work that he's been doing for the past year or so. And he had a life before public service, but briefly he was, or not briefly, but for a period of time, he was Deputy Commissioner of Securities Division, and also dealt with that little issue having to do with JPEAK and that EB5 project. So you only do small stuff between pandemics and foreign investments and whatnot. Before public service, his life before then was practicing law, both with a firm in New York City and locally in Vermont with Downs, Racklin, and Martin. So we appreciate all the work that you've done over the past year plus of pandemic too. And even the financial services stuff that you do as a side gig when you're not working on pandemics. Thanks for joining us this afternoon.
Yeah, no, well, thank you, Joe, and thank you to everybody. It's a pleasure to be here with you all. I know I was scheduled to be with you a couple of weeks ago, and I had, unfortunately, when the governor and his team put a meeting on your calendar about vaccines, as we're nearing the end of the pandemic, it's one of those meetings you can't miss. So
right.
I apologize for not being able to join you then, but I'm really glad I was able to join now, and really glad I can tag team with Dr. Levine as well, because he's been such a pleasure to work with, and certainly such a pleasure to get to know from my perspective. And I'm sure all Vermonters feel the same, that it's been a pleasure to get to know him, albeit virtually and remotely during the pandemic, but definitely want to thank him for all his excellent work. So, I thought I would touch upon just a few things that are happening at the department, provide an opportunity for any questions that folks have, whether it's COVID related or whether it's, financial services related, but also interested to hear if you would, like, any experiences that you're having at your credit unions, particularly around your business members and any workforce issues that they're having. I mean, you hear a lot about the challenges that employers are having, and you see it in the data when the unemployment rate is really low, but the number of people in our workforce is down by 10, 20,000 people, and that's certainly a challenge. And just interested to hear from everyone here any perspectives that you have on that. I think broadly, though, from a financial services standpoint, we've talked about this before, I know on one of these calls, but credit unions were really strong. The industry was really strong heading into the pandemic, and really want to thank all of you for all your work, making sure your institutions were safe and sound. When something like this comes along that's so unexpected and so extreme and can be so detrimental, all of you were on really solid, sound footing to react to it. And you provided flexibility to your members. You helped Vermonters get through this. We have not seen a deterioration in asset quality. We've not seen an increase in delinquencies. It's really been quite remarkable. Also, for those institutions that helped out on the Paycheck Protection Program, that was very, very important for Vermont businesses, and really a critical lifeline to many of them. And it wouldn't have happened without all the members and all the members of the credit unions, all the staff, and of our banking communities as well. So just want to thank you for all that work that you've put in. And I know John asked a question about basically around employee safety, but just want to mention that to you. All of the institutions I know we're really focused on keeping employees safe, and you did a great job during the pandemic on that front as well. There's a lot of consumer issues. I know people wanted to do different things in person. They needed to be interacting with your staff, but from everything I can tell, both from the COVID numbers, but also from our own department work, all of the financial services industries did an incredible job servicing their customers and keeping their staff and workplace safe. So congratulations on that as well. The thing that is probably the most remarkable when we look at our numbers here at the department is the fact that among Vermont credit unions, from the beginning of the pandemic, right at the end of 2019 to the most recent quarter, that deposits at our credit unions and our banks too, but our credit unions are up over 30%. I think a lot of that is, maybe paycheck protection money that hasn't yet been spent, but I think a good portion of that is money that Vermonters have put away and saved because, there weren't necessarily opportunities to, to spend the money in ways that people did pre-pandemic, whether it's trips or going to a wedding or going to events. So it does seem like, I'd be interested in your perspectives on this as well, that there's the federal stimulus has come in and certainly helped us, but at the same time, there's this additional, pot of money there that Vermonters are ready, willing, and able to spend when things return to normal. So I really do anticipate the Vermont economy continuing to be really strong throughout the near term, certainly through the summer and into the fall. And really that big challenge of workforce, you could call it workforce development, but just having enough people in the workforce to do all the work that many businesses across the state need is the one glaring challenge that sort of stands out. But all indications are that we should be in for a pretty strong recovery here. The recovery seems to have already happened across the country and also here in Vermont as well. And I think that's really good news, obviously, for Vermonters and for all of our regulated entities as well. A couple of things I wanted to mention relating to the department as we start to focus more, or at least myself start to focus more exclusively on DFR and financial services work. A couple of things that are long-term issues that are starting to be addressed in a more significant way, both at the federal and state level, are a couple of issues that we have on our radar. The first is climate change, and the second is diversity, equity, and inclusion. And on the issue of climate change, we've been trying to find ways as a regulator where we can help our industries, navigate, mitigate the impacts of climate change. And one of the things that we're about to do this week is release a report looking at Vermont's insurance industry and how the Vermont insurance industry over the past decade has been impacted by the changes to our weather. So I think all of us can sort of assume or know what the trends are, but our weather has been getting consistently warmer in New England, particularly in Vermont. Burlington's one of the metro areas that's seen the largest average increase in temperature over the past few decades. It's meant that our winters are more mild. We don't have as many snow-covered days. We might not have as much accumulation of snow. That means for our insurance industry, there are certain claims that have always been there that they sort of banked on, if you will, during the winter. They tried to survive the winter and tried to survive the extreme weather that we experienced. So you might have houses that have roofs that cave in. You might have trees that get knocked down onto cars, onto homes. You might have auto accidents from ice storms and the like. But with those more mild winters, you're seeing potentially a little bit less of that activity occurring. But the trends that are happening in weather are somewhat concerning. We're seeing more wind events, more hail events. So in the last 10 years, the two biggest days of claims were a windstorm that occurred in October and a hailstorm that occurred in May. So we're getting weather that's different and unusual. That's having an impact on our insurance companies. They're going to have to underwrite for that. They're going to have to understand that changing dynamic. We're also going to have to understand what that impact is on their financial portfolios as well, as the country more and more moves to a lower carbon economy. What does that mean for their portfolios and their investments? And in that regard, just today we issued a comment letter to the U.S. Securities and Exchange Commission recommending, advocating that they go forward with a plan to require publicly traded companies to disclose on a uniform basis their carbon emissions, their carbon impact on a mandatory basis, so that investors, whether institutional investors, whether individual investors, can very easily understand the different impacts that businesses are having, publicly traded companies are having in the United States and around the world, compare them to each other, and make sound financial investments, and also make sound social investments as well, depending on where they want to put their money. So that's a request that the SEC had out for comment. It closed today. I think maybe a few other states or regulators will comment as well, but we really think it's important that these kind of mandatory disclosures be provided to the investing public. So it's another area where we've been trying to do some advocacy and some work, but certainly really interested in ideas and thoughts that the banking and credit union industries have, because this issue certainly is going to impact all of us. As we see more and more parts of Vermont entering into the floodplain or entering into floodplains over the next number of decades, that's going to be a concern for anyone that's lending, anyone that's insuring property throughout our state. So certainly interested and anxious to work with the industry on that. And then also on the diversity, equity, and inclusion, this is something that I think as a regulator starts at home. We've been working to establish a diversity, equity, and inclusion committee here within the department. We've been working to gather data on our workforce to understand how diverse it is or how diverse it may not be. But we really think that that's important to have that kind of information so that you can benchmark and understand, where you are relative to where you want to be, and how you can change some hiring practices, be more inclusive, be casting a broader net to attract a more diverse workforce. And it's not just diversity for diversity's sake. I mean, studies have found time and again that more diverse organizations make better decisions, they're more profitable, and from a regulatory standpoint, that means they're less risky, and they're the kind of entities that we want to regulate. So I really do think this is just like the environmental, just like the climate change issue, there's certainly a social and societal importance to it, no doubt, but there's also a business case or an economic case to be made that that we need to lean in to this work. So again, on that diversity, equity, and inclusion front, the department will again host a roundtable. We hosted a roundtable a couple of years ago on cybersecurity. We plan to again host a roundtable this September, both in person and hybrid, specifically to the issue of diversity, equity, and inclusion in financial services. We want to have speakers that highlight, again, that business case for having diverse organizations. We want to have panels and speakers that highlight some gold standards, some guidelines from entities around the region and around the country that have implemented DEI policies within their organizations. And then we also want to hear from our own regulated community here in Vermont, credit unions, banks, insurance companies, investment firms that have been implementing DEI policies, have been implementing DEI committees, have found things that have worked for them, have made progress, have seen that impact their organization in beneficial ways. We want to also highlight those stories so that others within the financial services in Vermont can hear and learn from those that have been making progress. So we don't have a date yet for that roundtable, but it will be in September. That's our goal, probably late September, and do hope that we get a good attendance. The last time we had the roundtable, hopefully many of you were able to attend, or people on your staff were able to attend, and hopefully they found it worthwhile. I think there was a lot of opportunity for information sharing, a lot of opportunity for networking as well, and certainly we want that to be the case with the upcoming roundtable also. So I'm happy to stop there and take any questions that, again, folks might have, either about work that we have underway here at the department or any COVID-19 related work as well. I'll just mention, I think Dr. Levine, I heard most of what he said, but we're obviously feeling very optimistic about where we are. We think, we are the best state to be in a position to fully reopen. We have the lowest case rates in the country at the moment, lowest hospitalization rates at the moment. We have the lowest fatality rate at the moment as well. We've had, unfortunately, we did have a fatality in the last couple of weeks, but we've only had one death in the last 28 days. Things have gotten remarkably safer here in Vermont. It's been getting safer and safer by the day, but just in the last few weeks, it's really been quite incredible. And with the uptake that we're seeing among our population with the vaccine, there's all the reason in the world to think that that cone of safety that we have is going to be here with us for quite some time. And again, we mentioned sort of in a way that was not so great earlier on in the pandemic that Vermont is not an island, that we rise and fall as the states and regions around us rise and fall. But again, Vermont's not an island in a good way this time, that many of the jurisdictions around us have really high vaccination rates. So all of New England, much of the Northeast is in a really strong position, going into the rest of the year to put the pandemic in our rearview mirror. So we're definitely feeling very optimistic.
Thank you, Mike. A great update from DFR. Any questions or comments from anybody for the commissioner? Feel free to jump right in. Or not. We had TJ Donovan with us some weeks ago. I forget how far back it was. And we discussed, one of the things that he discussed briefly was the increased incidence from a financial institution perspective of fraud that was perpetrated on Vermonters, under the guise of, under the guise of a whole lot of things, but all related to the pandemic one way or another. And have you seen that crossing through your regulated industries?
Yeah, for sure. There was a recent report coming out talking about compliance costs for financial service institutions to try to combat these types of frauds. And I think the amount was a 1/3 increase in 2020 compared to previous years. And no doubt we're seeing that in Vermont, and it unfortunately makes sense. We have so many Vermonters that maybe they used online services before, maybe they didn't, but they were sort of forced to use them, and they did that, in the comfort of their own home, independently from, maybe their trusted, banker or credit union. And it just made it a ripe opportunity for fraudsters to, take advantage of those populations, people that didn't know that, your bank or credit union wouldn't be calling you and asking you for your account number because you have a transaction that they need to process, So it just made it, all the more challenging to keep Vermonters safe and free from frauds and scams. So that's certainly an area, and again, if anyone has experiences from their own shop, I'd certainly be interested to hear, but it's certainly an area where, we try to do everything we can to educate the public. Obviously, we were hampered because we couldn't be going out and doing the sort of financial literacy and scam type events that we normally do. We usually have a team that's out there, 3-4 times a month, trying to speak to as many people, particularly seniors, as we can, to talk about the general trends of fraud and anything that is happening at the moment that's sort of new onto the scene. So we're hampered by that. They're isolated and alone, and it really makes for the worst case scenario. So anything that we can do to partner with our regulated entities, our credit unions, to try to combat this, certainly we are all ears and totally game for trying to combat this, because in my opinion, it's one of the worst possible crimes that somebody can do, is take advantage of somebody that's in a vulnerable position, that needs help. And I think most of us on this call would see that situation and try to do the right thing for that person. And I just can't imagine someone that would see that situation and want to take advantage of them financially, but we know that that happens.
For sure. Thank you. Comments, questions, anybody? Jean?
So we also talked a little bit about cryptocurrency while we were with TJ Donovan, and wondered what your department's doing in this area.
Yeah, so that crypto space is quite quite alive, I guess I would say. I mean, the sort of the blockchain revolution, if you want to call it, I don't know if it has stalled out for a little while, or the ways that it was going to change the world immediately, I think, have maybe just sort of slowed down for the moment. But cryptocurrency has continued to be quite mainstream, if you will, and been quite engaged. So, we register the money transmitters. They include the crypto exchanges that do business here in Vermont. So one of the things that we do is we really try to survey the landscape, and if there is a entity that's doing business in Vermont that's not licensed, that is not registered, we will engage with them, issue a cease and desist if we need to, and get them licensed, because that licensing does require some due diligence on our part to verify that this entity, is legitimate, that they're doing some basic, due diligence on their customers, on their exchanges, that they have a good reputation. So that's certainly something that we've done to be proactive in the space. There's also new products out there that are looking, a lot like a traditional financial service product, but it's dressed up in a lot of technology and a lot of lingo. And that technology and lingo, I think, is designed to try to maybe evade some of the decades-old regulatory regimes that are in place around securities and around banking. So we've been very keen on that, and looking for examples of businesses operating in Vermont that we think have business models that put Vermonters at risk, and maybe the Vermonters aren't even aware of that. And I can't speak to freely or broadly about that at the moment, because we do have some active investigations underway. But we certainly are trying to find situations where Vermonters are taking on risks that they don't understand that they're taking on, and trying to prevent that from happening again, either by getting these entities licensed or by not allowing them to do business here in Vermont. At the end of the day, the crypto situation is, I saw somebody make the analogy that it was like baseball cards, and maybe it's a fair analogy, but the baseball card, the Ted Williams rookie baseball card doesn't really have a lot of value in it. You can't put it in your car to drive it. You can't, eat it. You can't use it to make a house out of, but you can sell it to somebody, and what it's worth is whatever that person is willing to pay you for it. And it does remind me a lot of the cryptocurrencies. There's no intrinsic value. The value is what we all place on it. And when there are moments of extreme volatility, that value that we place on it can go up and down in quite a hurry. So it really, I continue to view it as speculation. It's not obviously, investing, but there are certainly a lot of people, a lot of Vermonters that are interested in putting their money into different cryptocurrencies. So again, we've been trying to allow for that where appropriate, but wanting to get some of the bad actors out of that space, so Vermonters aren't unduly put at risk. So we'll see where it all heads. I mean, I think there's certainly some advantages of cryptocurrencies in certain circumstances relating to money, moving money around the world with ease. But I'm still a little. I guess I'm still a little skeptical on where they will end up, in the next few years or next decade.
There was legislation passed in the past year or two in Wyoming, I think it was, that, and you might know more about it than I do, that did it authorize the creation of a crypto entity, a bank basically, but dealing in crypto. And then I know more recently, and I think it was this past legislative session, there was a bill in the Nebraska legislature that passed that authorized, I believe, state chartered institutions, their banks, not credit unions, to get involved in various, whatever types of cryptocurrency. And I don't know the details or anything. And I don't think anybody has done it yet, but I don't know where the activity in those states are going, but it is a brave new world. And, you know, some people are going to be plunging headlong into that arena, I'm sure.
Yeah, and there is obviously the potential for value and upside there, and we don't want to discount that. But you know, there's also the potential for risk, and that's of concern certainly too. So people need to know, you know, what they're getting into. Yeah, the Wyoming legislation, you know, that was passed, I think, with the thought that there would be some great economic development with it. And as far as I know, there has not seemed to be any legitimate, you know, businesses that have taken advantage of it that have appreciably impacted the Wyoming economy.
It was shared with me that it was sounding like Wyoming legislators had this vision that Wyoming would be to crypto institutions what Vermont is to captives. And
yeah,
right, it hasn't panned out that way yet.
Yeah, we have the benefit of, in Vermont, we have the benefit regulatorily of, in the captive world, in the insurance world, of being the sole regulator in insurance, right? The state-based regulation, there's no federal regulator. Gets a little bit more complicated when you're in the crypto space, when, you know, you could have multiple banking regulators. You could also be impacting the securities laws, and there could be state and federal securities laws implicated as well. So it's not as clean of a jurisdictional, situation where you can provide this sort of structure. But people think that captive insurance is difficult to understand, but at least people, I think, can understand the concept. Like, a lot of people can't even understand cryptocurrency. So it's you know, I think it's even more challenging to imagine a jurisdiction that would become the premier crypto domiciliary. And I don't think it's even maybe necessary either. I think the companies in this space are operating either within the current regulatory structure without the need for that kind of safe haven, if you will, or they're working outside of the structure and they're not too interested in establishing somewhere.
Thank you, Mike. We've reached the end of our hour. Any final question, comment from anybody? If not, again, thank you, Commissioner Pieciak, for spending this time with us. We appreciate it. And thank you for all your work that you did through all this pandemic. Not that and I don't know if it ends for you yet or not, but whether it does or not, you've done a great job tracking everything and keeping us all apprised of where we've been and forecasting where things are going to go. So that's been greatly helpful to all of us, I think, during all of this time.
Well, thank you. And yeah, thank you. And again, thank you to everybody on the call. Thank you for having me, but thank you to everyone for everything you've done in your personal lives and in your professional lives to keep Vermont safe. It was a team effort from A through Z. And I think Vermont really was able to show the country how to do this effectively. So congratulations to all of you as well.
Thank you. Thank you.
Thanks.
Thank you, everybody, for joining us. As I put in the announcement this morning, this is the last scheduled weekly meeting that we're going to have for a while, but watch for updates on what we come out with in the future. We'll probably go to once a month or as needed. So hope you have a good rest of your week.